The American Psychiatric Association says that depression is a common and serious medical illness that negatively affects the way you feel, the way you think, and the way you act. Many people around the world today have depression and have a hard time coping with it. They struggle every single day, and some feel as if they cannot get help or don't want to get help, which worsens over time. Finding ways to cope and to try and cheer yourself up when you have depression can be very hard for some people. You feel as if nothing can or will get better, making you feel stuck and feeling more depressed. The Healthline says that some symptoms of depression are change in your mood, such as anger, aggressiveness, irritability, anxiousness, anything. It's different for everybody. Everybody feels differently. Feeling emotions such as sadness or hopelessness or anger. Change in your behavior such as loss of interest in your hobbies, feeling tired all the time, sleeping more than you would, using drugs or drinking excessively to try and take your mind off of things, not getting proper treatment can lead to worsening of your symptoms, and you can start to see change in your physical appearance, such as gaining weight or losing weight, depending on how you cope with your sadness. You can feel fatigue, headaches, and even start to see digestive problems. Treating depression can be difficult for some people. Different treatment options are seeing a therapist or getting medication. Seeing a therapist is usually what they first want you to do, to try and talk to someone so you don't have to take medication for it. But sometimes seeing a therapist doesn't always help because you can't connect with them or you have a hard time opening up to people. So then you can be put on medication that will help you. Depression doesn't always appear out of nowhere. Something in your life can happen that can trigger it, such as the loss of a family member or a divorce of parents, work or school, and there's even seasonal depression. The Mayo Clinic says that seasonal depression is a type of depression that relates to changes in seasons and usually begins and ends at about the same time every single year. Most people with seasonal depression start to see it occurring around fall, and it goes into winter because something about the snow and the cold, they don't like it. It makes them feel low about themselves. Even the holidays, if you don't have a significant other or if you don't have a lot of family, that can be sad. And then they often start feeling better around the beginning of summertime when it starts to warm up and gets happier. Receiving help if you think you have depression is so important because continuously feeling low can cause bad thoughts to happen in your head, such as suicide. Finding ways to cope and to get yourself in a better state of mind is very important for your health. If you feel as if you might have depression, seek help immediately because you can and will get better if you want to. The doctor can help you find the right therapist, get on the right medication, and just overall help your state of mind and make you feel happy and healthy.